Hello everyone. So today we are going to discuss about thoracoabdominal diaphragm. So as we have already discussed about pelvic diaphragm, so we know the definition of the diaphragm. So what is diaphragm? So any sheet like partition that is dividing into two compartments above or below, that is called as diaphragm. So in this thoracoabdominal diaphragm, by the name only we can say the thoracoabdominal diaphragm means what? It is creating a partition between the thorax and the abdomen. So it is the major diaphragm of our body, and the shape, it is dome shaped musculo-tendinous sheet that creates a partition between the thorax above and the abdomen below. So dome shaped. So you can say if this is the trunk of the body and here some like this dome is present, so this above thing will be thorax and the below part will be the abdomen. So this dome shaped partition, musculotendinous partition, creates two compartments, thorax and abdomen below. So this dome has one right convexity and one left convexity. So there are right convexity and this left convexity, and in the middle part depression is there, and this convexity, the summit of this convexity is called as cupulae. So the diaphragm, it has a right and left convexity and the middle depressed part. So the right convexity will be little higher than the left one. Why? Because on the right side, because of the presence of liver, the right convexity of the dome will be more than the left side. Now we'll see this in the diagram. In this you can see this is what? This is diaphragm. Okay, and it is like you can see this is what? The sternum, the manubrium sternum, the body of the sternum from the xiphoid process, and these are what? The ribs. The 7th, 8th, 9th, 10th and 11 and 12 will be present. So in the between this all part, this diaphragm is present. Okay, and you can see this is the right dome and this is the left dome and the median depressed part. Okay, now we'll see the where does this diaphragm originates from. Origin of the diaphragm, it has three origins. One, sternal origin, second is the costal origin, and third is the vertebral origin. So it means what? Sternal means from some part of the sternum the diaphragm is originating, and it has a costal means from the ribs and the costal cartilage, and the vertebra means from some of the vertebra it is getting origin. Okay, so we'll see this in a diagram. So before seeing the diagram, in this image only you can appreciate key the sternum, the lower end of the sternum, the lower part, the xiphoid process of the sternum is giving origin to the diaphragm. The lower six ribs and the costal cartilage are giving the origin, and behind you can see here the lumbar vertebra. The lumbar vertebra and the thoracic vertebra are giving the origin to the diaphragm. Okay, so in this way the diaphragm is formed by the sternum, the costal cartilage and the ribs and the lumbar vertebra and the thoracic vertebra. And so this diaphragm, it has a peripheral muscular part and the central tendinous part. That's why it is called as musculo-tendinous partition. Musculo-tendinous means it has some muscular content and some tendinous contents. Now let's make the diagram of the diaphragm. So we are seeing the diaphragm from the abdomen. So we'll reflect this part and we'll see here. Xiphoid process, seventh rib, eighth rib, ninth rib, 10th rib, 11th rib, 12th rib. Similarly on this side, 7th, 8th, 9, 10, 11 and 12th rib. So seeing this, you can say the xiphoid process and the lower 6 ribs and the costal cartilage will give origin to the diaphragm. And now we'll make some vertebra in this. So we'll make this in a lighter color. So for example, I'm making it in a T12, L1, L2, L3. So the origin of the diaphragm. So I have told 3 origin, 1, 2 and 3. So now we'll put this in the diagram. So from the xiphoid process, 2 fleshy slips will give origin to the diaphragm. Then from the lower 6, the ribs and the costal cartilage will give origin to the diaphragm. So now we know the origin. First origin is what? The sternal origin, that too from the posterior surface of the xiphoid process. 2 fleshy slip, muscular fleshy slip will come from the posterior surface of the xiphoid process to form the diaphragm. Then lower 6 ribs plus the costal cartilage will give origin to the diaphragm. Now the third, vertebra. So in the vertebra, a pair of crura, that is right and left crus of diaphragm, then a pair of medial arcuate ligament and a pair of lateral arcuate ligament. So this all will give origin from the vertebra to form the diaphragm. So the crura, the crus, there are right and left crus of the diaphragm. So the right crus, it originates from the body, the anterior part of the body and the intervertebral disc of L1, L2 and L3. Similarly, the left crus is formed by the body and the intervertebral disc of L1 and L2. This both right and left crus will meet to form one more ligament which is present at the middle. So it is called as median arcuate ligament. Okay, this was about the crus of the diaphragm. Now the medial arcuate ligament, we'll see. The medial arcuate ligament will arise from the, so this all are pads structure. So the medial arcuate ligament will arise from the front, or you can say the anterior part of the body of L1 and L2, and it will go and insert into the tip of transverse process of L1 vertebra. So actually this medial arcuate ligament will be arching over the psoas major fascia, and it is formed by the thickening of the psoas fascia, this medial arcuate ligament. So from this the diaphragm will originate. Similarly, this lateral arcuate ligament, it is arching over the quadratus lumborum muscle, and it is formed by the thickening of anterior layer of thoracolumbar fascia. You can say the lateral arcuate ligament, it will arise from the tip of transverse process of L1 to the lower border of 12th rib, and this will go and interdigitate with the transverse abdominis muscle. Now, as we have seen the vertebral origin, from where the crus, right and left crura of the diaphragm, then from the pair of medial arcuate ligament, then the pair of lateral arcuate ligament. So now we'll put this in the diagram. So as we have already seen, this is what sternal origin, and this all are for costal origin. Now we'll see the vertebral origin. So as we know, the right crus, so one more thing will orient this diagram. So this is anterior part, this is posterior part, this is right end and this is left end. Now we'll see. So you can see this is what? Anterior, this is posterior, this is right and this is left. Now we'll put the right crus. The right crus, it originates from the front of the body and the intervertebral disc of L1 to L3. Similarly, the left crus will originate from the L1 and L2. And this both will meet at the midpoint. This part is called as, this is what? Median arcuate ligament. And this is right crus and this is left crus. Now, from the right crus, one more, here I am making the transverse process of L1 vertebra. So from the front of the, then from the front of the body of L1 towards the tip of the transverse process. Similarly, from the front of the L1 or toward the tip of the transverse process. This is what? Medial arcuate ligament. Then from the tip of the transverse process towards the lower border of T12 vertebra. This is lateral arcuate ligament. And in this diagram only I will put muscles. So from the lateral border of from the lateral border of the body of L1, L2 and L3, here you can see one fascia. This is what? Psoas fascia. And lateral to this there will be quadratus lumborum. So this muscle is what? Quadratus lumborum. And here you can see transverse abdominis. So this is psoas major muscle. This is quadratus lumborum. This is transverse abdominis. So that's why you can say the medial arcuate ligament arches over the psoas fascia and it is formed by the thickening of the psoas major muscle. And the lateral arcuate ligament arches over the quadratus lumborum and it is formed by the thickening of the anterior layer of thoracolumbar fascia, and it will go and interdigitate with the transverse abdominis muscle. Now we can say the vertebral component from which the diaphragm is coming is what? From the crus of the diaphragm, right and left crus of the diaphragm, from the medial arcuate ligament, then from the lateral arcuate ligament. So in this way the muscular origin of the diaphragm occurs. Now this all thing are coming towards the central part and it is going towards a leaf, trifold leaf like central tendon. This is called as central tendon. What? This is central tendon which is having a appearance of trifold leaf. You can say three margins of the leaf like this. So in this way it has what? Median leaflet, right leaflet and the left leaflet. So in this way the muscle that is originating, it will come and converge toward the median depressed part that is forming the central tendon of the diaphragm. Now we'll see the openings that are present in the diaphragm. The openings that are present in the diaphragm. There are three major openings and some minor openings. Okay, three major openings and some minor openings. So the three major openings you can remember by a mnemonic called as Voice of America, where V is the vena caval opening and O is the esophageal opening and A is the abdominal aorta or aortal opening. And to remember the origin or the vertebral level of this opening, you can remember it by another mnemonic I 8 10 x at 12. 8 means 8 T8 level. The vena caval opening will begin. 10 T10 level. where the esophageal opening will begin, and 12, T12 level, where the abdominal opening will origin. Now, the three major opening will enlist it. The vena cava opening. So, this opening is present in the central tendon between the median, this is median and the right leaflet. So between that, here somewhere there will be opening present for the vena cava. Okay, and the second opening, which is what? Esophageal opening. It is formed by the splitting of the right crus of the diaphragm. So this right crus will split to form second opening. Okay, so this opening is called as esophageal opening, which is formed due to the splitting of the right crus of the diaphragm. And the last opening, it is present, you can't say it is opening from the diaphragm. Actually, it is present behind the diaphragm, between the lumbar vertebra and the median arcuate ligament. There will be the opening for the abdominal aorta. So near this part. So this is the third opening. Okay, so the three major openings, what are they? This is first, which is vena cava opening. This is second, which is esophageal opening. And this is third, that is present behind the diaphragm, that is abdominal aortal opening. So what are the structures that comes through this vena cava opening? So through the vena cava opening, inferior vena cava plus the right phrenic nerve will open through this vena cava opening, inferior vena cava and the right phrenic nerve. So if this is where, if for example in the median depressed part, this median depressed part is there, here where the heart and the fibrous pericardium will be present. So from here the IVC will open into this, the diaphragm, through the diaphragm into the abdomen. And along this, what? The right phrenic nerve will enter through this. Now, so if we have seen the right phrenic nerve, similarly the left phrenic nerve will come and it will pierce the diaphragm through the left cupula of the diaphragm. Left, in the left dome, the summit point, the left cupula, from where the left phrenic nerve. The right phrenic nerve will come through the vena cava opening. Now the esophageal opening, you can say, this is esophageal opening. So through the esophageal opening, the structures that are coming from the esophageal opening are esophagus plus the vagus nerve, the anterior and posterior vagal trunk will come through the thorax, and as it will go to the abdomen, the anterior will form the left vagus nerve and the posterior will form the right vagus nerve. And along this, the left gastric artery will give esophageal branches that will go travel through this. So what? Esophageal branch of left gastric artery. Similarly, esophageal tributaries of the left gastric veins. And the last major opening, which is not present through the diaphragm, it is present behind the diaphragm, between the vertebra, T12 vertebra and the median arcuate ligament, and in the side, the right and the left crus of the diaphragm, where the aortal opening is present. And through the aortal opening, what structures pass are, we'll remember this by mnemonic, aorta. So this aorta means abdominal aorta will arise, T, thoracic duct, and A, azygous vein. So these all structures come through this aortal opening. What? Abdominal aorta, thoracic duct, and azygous vein. So this was all about the major opening, and we know the levels. At what level? At the T8 level, the vena cava. At T10 level, at T10 level, the esophageal opening. At T12 level, the abdominal aorta opening will be present. So now in this way, we have seen the major opening. There are some minor openings. So for the minor openings, you can say in this diagram, so this place between where the sternal origin of the diaphragm is coming, the space where the present, that space is called as space of Larry. And through the space of Larry, the so through this space of Larry, superior epigastric vessels that are coming from the internal thoracic artery will travel through this space that is present in between the posterior surface of the xiphoid process and the sternal origin of the diaphragm. So this space is called as space of Larry. When this space is enlarged, it is called as foramen of Morgagni, that we'll see in the diaphragmatic hernia. And through the digitations of this costal origins and the diaphragm, the lower five intercostal nerves and vessel will pass, and from the origin of this 7 and 8 costal cartilage in the diaphragm, the muscular phrenic vessels also pass. And as we have seen, 1, 2, the space of Larry where the superior epigastric vessels, minor opening, and through the costal origins and the digitation of this costal origins and the diaphragm, lower 5 intercostal vessels and nerves will pass, and through this median arcuate and the lateral arcuate ligament. Then through this lateral arcuate ligament, behind this lateral arcuate ligament, subcostal vein, subcostal artery, and subcostal nerve will pass. So behind the lateral arcuate ligaments, subcostal nerves and vessels will pass. Then through the medial arcuate ligament, the sympathetic chain and sometime the least splanchnic nerve will pass. So mainly the sympathetic chain. So through the medial arcuate ligament, behind the medial arcuate ligament, sympathetic chain will pass. Then near this crus, right and left crus of the diaphragm, the greater and the lesser splanchnic nerve will also pierce. Okay, the greater and the lesser splanchnic nerve will pierce the right and left crus of the diaphragm. So in this way we have completed the openings of the diaphragm. So major opening we know. Now the minor opening, we know what space of Larry, superior epigastric vessels will pass. Then between the interdigitation between the costal origin and the diaphragm, lower 5 intercostal nerves and vessels will pass. Behind the lateral arcuate ligament, subcostal vessels and nerves will pass. Behind the medial arcuate ligament, sympathetic chain. Between the right and left crus of the diaphragm, the greater and lesser splanchnic nerve will pierce. Now, what will be the, so in this way we have seen the majority part of the diaphragm. So next we'll see the motor supply, or you can say nerve supply. So nerve supply will divide this into motor and sensory. So the motor supply will be through phrenic nerve, that is C3, C4 and C5 root value. Sensory supply to the middle depressed part, that is the central tendon. It will be given by the phrenic nerve only, but the peripheral part, it will be supplied by the lower 5 or 6 intercostal nerve. So the majority of the supply, the nerve supply will be the phrenic nerve, and only the peripheral part of the diaphragm, the sensory supply by the lower 5 intercostal nerve. Similarly, the blood supply to the diaphragm. Blood supply is mainly by the inferior phrenic artery, which is the first branch of the abdominal aorta. Then superior phrenic artery, which is the last branch of the descending part of the aorta, and it is also supplied by the musculophrenic artery, pericardiophrenich artery. These are all the parts of internal thoracic artery, and so this is all about the blood supply. What? Inferior phrenic artery gives the majority of the blood supply, then superior phrenic artery, musculophrenic artery, pericardiophrenich artery. Now, as we have seen now the nerve supply and the blood supply, now we'll see the action of diaphragm. So diaphragm will act on thoracic cavity, abdominal cavity, and where the openings are present in the diaphragm. So actually the diaphragm, it is a major, or you can see the main muscle which helps in inspiration during breathing. Okay, so during the inspiration, when we'll inhale the air, so the diaphragm, it is the main muscle of inspiration. So when we'll breathe during the process of breathing, So during the process of inspiration, like when we'll take the air inside, the diaphragm will go down. So in this way, in the thoracic cavity, it will increase the anteroposterior and the transverse diameter. So in this way, the action of the diaphragm in the thoracic cavity is what? It will increase the anteroposterior plus it will increase the transverse diameter of the thoracic cavity. Now, as we know, during the inspiration, the diaphragm will go down. So when it will go down and it will contract, so the abdominal viscera will be compressing downwards and it will increase the intra-abdominal pressure in the abdominal cavity. Now, the third is the opening. So in the opening, so as we know, so this is the diagram. So when this diaphragm contracts, okay, so when this diaphragm contracts, firstly at the vena cava opening, when this diaphragm contracts, this central tendon will be relaxed. So during the process of contraction, like during the process of inspiration, the diaphragm contracts and the central tendon will be relaxed. Because of the pulling of the diaphragmatic muscle, the central tendon will be relaxed. So in this way, the vena cava opening will put, like, the more blood will enter into the right atrium through the inferior vena cava. So what is the action in the at the vena cava opening? The vena cava opening will be dilated and the more blood will enter into the right atrium. Similarly, in the crus of the diaphragm, or sorry, in the esophageal opening, when this muscle contracts, this esophageal opening will be constricted. So what means, during the inspiration, this esophageal opening is constricted. So in this way, the abdominal reflex or the regurgitation is not going towards the lower end of the esophagus. So in this way, the regurgitation of the stomach acid is prevented. So at the level of esophageal opening, during this contraction of the muscle, the esophageal opening is constricted. Now, the aortal opening, do you think there will be any action during the contraction of this diaphragm on this aortal opening? No, there will be no effect on the aortal opening during the contraction of this abdomen. Why? Because it is present behind the diaphragm. It is not, this opening is not present in the diaphragm. It is present behind the diaphragm between the T12 vertebra and the median arcuate ligament. So there will be no effect on the aortal opening. So now we'll write here. So in the vena cava opening, the dilatation will be there, and in the esophageal opening there will be constriction, and in the aortal opening no effect. So this all thing will occur when the diaphragmatic muscle is contracted, or else you can say during the process of inspiration. Now the last thing that is left is diaphragmatic hernia. The diaphragmatic hernia, firstly, if from the space of Larey, what is space of Larey? From the posterior part of the xiphoid process to the two fleshy slips arise to form the diaphragm. So if there is no sternal origin of the diaphragm present, the absence of sternal origin, it will lead to the enlargement of this foramen. That foramen is called as foramen of Morgagni. So from this foramen of Morgagni, the abdominal viscera will herniate into the thoracic part. Now the second diaphragmatic hernia, it is called as Bogdahl's hernia. So when does this Bogdahl's hernia occur? For that you should know one trigone, costovertebral trigone. So if the diaphragm is failed to origin from this lateral arcuate ligament of one or both side, so there will be what? This is costal cartilage and this is vertebra. So here the trigone is formed, the costovertebral trigone or Bogdahl's trigone. From this area the abdominal viscera will herniate. So the failure of origin of diaphragm from the lateral arcuate ligament is forming the Bogdahl's hernia or costovertebral hernia. So in this way we have discussed two. And the last one, if this esophageal opening is dilated more, that through this dilated part, and one more thing, this esophageal opening, it is supported by one more ligament which is called as phrenoesophageal ligament, that is supporting this esophageal opening. If this esophageal opening is dilated because of this absence of this phrenoesophageal ligament, what will happen? The lower part or the gastroesophageal junction can go above into the thoracic cavity. So that type of hernia is called as the hiatal hernia. So the third is hiatal hernia. It occurs due to dilatation of esophageal opening. So the dilatation of esophageal opening, there can be in this hiatal hernia, there can be two types of hernia. One sliding hernia, one rolling hernia. If the gastroesophageal junction, so if for example, if this is the stomach and this is the gastroesophageal junction and this is the esophageal opening, and this esophageal opening will be supported by one ligament which is called as phrenoesophageal ligament. If this phrenoesophageal ligament is loose or it is absent, this hiatal hernia will occur. So if this gastroesophageal junction will go above into the thoracic part, that is called as sliding hernia. And if this gastroesophageal junction is in the normal position and this fundus part of the stomach will herniate into the thoracic part, that is called as rolling hernia. This sliding hernia is mostly seen in the gastroesophageal reflux disease. Okay. So in this way we have completed the whole diaphragm. So mainly we have seen what the diaphragm, it has main three origin, the sternal, coastal and the vertebral origin. There are three major openings, vena cava, esophageal and aortal opening at the T8, T10 and T12 level, and there are some minor opening, and in that also you should remember about the space of Leyre. If that is enlarged, it is called as foramen of Morgagni, and the major nerve supplied to the diaphragm is by the phrenic nerve, which the root value is C3, C4 and C5. And we have seen some of the diaphragmatic hernia. What is that? Foramen of Morgagni, then hiatal hernia which has sliding and rolling hernia, and one more is what is that? The Bogdahl's hernia, or if there is failure of origin from the lateral arcuate ligament. Okay, so in this way we have completed the whole gross part of the diaphragm. So in the next class we'll see the development part of the diaphragm. So in this way we'll conclude the class of today. Thank you. Please share, like and subscribe my channel. Thank you.